ಬಿಜಿಎಸ್ ಗ್ಲೆನೆಗಲ್ಸ್ ಗ್ಲೋಬಲ್ ಆಸ್ಪತ್ರೆಯ ಸರ್ಜಿಕಲ್ ಆಂಕೋಲಾಜಿಸ್ಟ್ ಸ್ತನ ಮತ್ತು ಸ್ತ್ರೀರೋಗ ಕ್ಯಾನ್ಸರ್ ತಜ್ಞರಾದ ಡಾಕ್ಟರ್ ಮೋನಿಕಾ ಪನ್ಸಾರಿ ಅವರು ಸ್ತನ ಮತ್ತು ಸ್ತ್ರೀರೋಗ ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ಜಾಗೃತಿ ಮೂಡಿಸಲು ಹಾಗೂ ಮಹಿಳೆಯರು ಯಾವ ರೀತಿ ಸ್ತನ ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ತಿಳಿದುಕೊಳ್ಳಬೇಕೆಂದು ಉದಯ ಸುದ್ದಿಯೊಂದಿಗೆ ವಿಶೇಷ ಸಂದರ್ಶನದಲ್ಲಿ ತಿಳಿಸಿದರು.
It's very important for women to know what are the symptoms of breast cancer. Most of the women, they come to us with the lump in the breast. That is the most common symptom. Other symptoms could be variation in the size, shape or architecture of the breast, blood stained discharge from the nipple, puckering or dimpling, that is the skin, changes of the skin on the skin of the breast. Sometimes even the skin on the breast becomes red and orange peel in appearance. These are the most common symptoms which we usually see our patients in our outpatient clinic. So again, a very important thing, what are the screening methods? So for that we need to understand what basically screening is. Screening is a test which is performed in a normal healthy individual at a frequent interval of time with the idea of detecting the disease even before they become symptomatic. So basically for breast cancer we are performing certain tests like mammogram to detect the lesion or a tumor in the breast even before a person herself or doctor can feel it. So it has to be performed in a normal and healthy individual. So what are the screening methods available for breast cancer? The gold standard is mammogram. Mammogram is an X-ray of the breast which is ideally recommended in all women above the age of 40 should undergo annual mammogram, that is mammogram once in a year. The other method which is recommended is breast self-examination. Basically this test is just to make women aware of their breast, that we call it as you should be breast aware, that you should know what normally the breast feels like. So what basically breast self-examination is, we say that all women above the age of 20 should examine their own breast once in a month. It is said that a week after your menstruation, where all the hormonal changes in the breast are minimum, tenderness is minimum. So breast self-examination has to be done a week after the menstruation. How it has to be done? There are various videos, but I'll just explain it in brief. That with the flat of 3 fingers, you have to examine your breast and armpit area in lying down position. Feel it in a circular movement or in upside downward movement. Examine the entire breast yourself and also the armpit area. Well, you lie down, breast flattens against the chest wall. So even if it's a small lump which you might miss while you're examining in the standing position, you might be able to feel it when you're lying down. So breast self-examination has to be done in lying down position and also in the standing position. Standing position, you have to stand in front of the mirror, examine both the breast, put your arms above the head and examine the armpit areas as well. If you notice anything abnormal, you have to report to your physician. So this is what breast self-examination is. For those women who are postmenopausal where menstruation has stopped, they can fix up any date in a month and then regularly continue their self-examination once in a month. So basically breast self-examination is that you are just examining yourself to make sure that you know how your normal breast feels, and then if any abnormality is picked up, you can just report it to your physician and get it evaluated further. So these are the 2 main screening modalities available. Obviously gold standard is mammogram.